My name is Joe Peroni, and this is the Rise Above Project. And today I want to talk about a therapy challenge in modern society. More specifically, I want to talk about CBT, which is cognitive behavioral therapy, and REBT, which is rational emotive behavioral therapy. Now, to be clear, these are different modalities, but they're very similar. And for today's show, they're similar enough not to separate them out. I'm still going to be able to make the same point. Both of these therapies are evidence-based. They're considered to be the most effective form of therapy. They're trusted, they're effective, and to say it again, they are evidence-based. However, what are we seeing over the last decade and a half or so? Well, there's been some evidence to show that there is a declining effectiveness in both of these therapies. There's been reports where a client would have, let's say, an unwanted event due to therapies like this. There's been reports of a negative well-being after these types of therapies. And these types of therapies are also causing some psychological stress. Now, how could this possibly be? This doesn't seem to make sense. Is it a problem with CBT and REBT? We'll get into the details a little bit more about what these are. But here's something interesting to know. I think Albert Ellis's book came out in 1959. So we're talking about, there's been about 60 years of CBT and REBT. However, that's marketing more than anything else, because the basic ideas of that have been around since the beginning of time. We can go back and see all the principles of CBT in Marcus Aurelius's book, Meditations. We can go back even further, and you see this in Buddhism. So this type of thinking that I'm going to be talking about has been around since the beginning of humankind. So why is it in just the last few decades or so, or even less than that, has these been not as effective, and it's been causing psychological distress? So we're going to talk about that today. But let's get into the first part. CBT has, what they're looking at here is, if you have a thought, leads to a feeling, which should lead to a behavior. When we're dealing with REBT, we have an adversity or an activating event, which leads to a belief about that event, which can lead to or does lead to a consequence. So again, they're very similar. Here are some of the basics to put this all together. What we're going to do in CBT or REBT is to challenge cognitive distortions and irrational beliefs. And then we want to change those irrational thoughts and beliefs and replace them with something that's skillful or productive. We also want to look at changing attitudes, perceptions that can lead to dysfunction. Now, on the surface, it's like when I was in graduate school, I used to argue with teachers all the time. Not in a bad way, but I would question them. It's like, why are we going through all the trouble to study this when it's basically common sense? Like, how is not living in reality going to lead to anything good? You know, I wanted to study more like Freud or Jung or somebody that was doing some very deep work. This is not deep work. This is just telling people that their dysfunctional behaviors, their irrational thoughts, their perceptions that are not based in reality are going to cause negative problems or negative situations. And that just seems to be something that any good parent should be able to teach a kid. It didn't seem to me anything that a therapist should really be spending a lot of time on. But as I got into therapy and I started dealing with clients, I started to realize, well, I was wrong. Like, this is the type of stuff that needs to be done all the time. And there is, again, it's evidence-based and it does work, but it works for the right people. So let's get a little bit more detailed here. So when we're dealing with this type of therapy, we're dealing with thought distortions, maladaptive behaviors. We're dealing with negative thoughts about the self, negative thoughts about other people, negative thoughts about the world and the future. Doesn't take a rocket scientist to understand that if you have all these, you're going to have anxiety, depression, or not perform well in the world. So again, we want people to respond rationally. We want people to have rational beliefs. We don't want people to have distorted thinking. Now, there's a huge list of distortions. So I'm going to read off just 15 of them for you to give you an idea. So we're looking at filtering, polarization, overgeneralization, discounting the positives. Again, a lot of people just focus on the negatives. Jumping to conclusions, catastrophizing, personalization, control fallacies, fallacy of fairness, blaming other people, shoulds, emotional reasoning, the fallacy of change, global labeling. In other words, all people are this, all people are that. Always being right. How many of us know people like this, right? They're very critical and condemning, and they're very judgy. And why? Because they think that they're right and everybody else is wrong. Anyway, so let's just take a look at that. So that's all part of CBT and REBT. We also want to eliminate a belief such as people who are overly upset all the time over other people's actions. They take it personally. People who believe that they must be perfect in order to be valuable. People out there who believe that avoiding challenges will make them happier. As we know, iron sharpens iron. You're going to need challenges to be a better person, to be smarter, to be tough, to be able to get through the rigors of life. If you really have the belief that avoiding challenges is going to make your life better, it won't. It's going to make it worse. There's people who believe that they have no control over their own happiness. This is not reality, and we need to take a look at that. People also believe that their happiness is dependent upon other people, and that's not true, and that they're only a good person if somebody else tells them that they are. All of these are false beliefs or irrational thought processes that need to be challenged and corrected. It makes sense. It has made sense since the beginning of time. So why is this not as effective as it used to be? Well, there's a few reasons. Let's go over them. Number one, in today's society, people believe that their opinion is correct. Now, through confirmation bias, because people don't want to challenge their own thinking, you can use Google or you can go on social media. And I don't care what opinion or thought or faulty perception you have, but you could go on these types of things, social media, find a YouTube channel, whatever you want to do, go on TikTok. You can find some person to justify or back up what you're saying. So you may never feel that you need to make a change. Why should you? You're going to go to a therapist who's going to challenge your faulty thinking, and you can back it up and say, well, this person who is an influencer in psychology, who's 19 years old, who doesn't have a degree, doesn't have a certification, doesn't have any life experiences, and you can listen to that person and they can tell you that you're right and everybody else is wrong. So we live in this world now where nobody has to take responsibility or accountability for anything. If you are a type of person, and I've seen this, if you believe that the Holocaust didn't exist, there is plenty of stuff on social media that you could find that will back up your opinion that the Holocaust never happened. Now, of course, I don't believe that, and that's because I'm a rational human being. I know facts. But there are people that you can't convince them that the Holocaust happened because they can find information that says it didn't. Continuing. People these days believe that feelings are more important than facts, more important than data, more important than statistics, and more important than reality. It's not. People also have this thought that everybody's entitled to their own truth. No, you're not. There is a truth, and then there is not truth. So we're not entitled to just think about whatever we want and say that it's true. We're entitled to our own feelings, but a lot of times these feelings are based off of perceptions that are completely faulty. Continuing. This day and age, it's very difficult, and I'm not going to blame a lot of the young people for this, because If you're a therapist today and you're working with young people, it is true that CBT and REBT is very difficult to, to be effective. There's nothing wrong with the therapy though. What is wrong is society. And you can see this because people can't handle criticism. They can't handle constructive correction. They can't handle that there are other people with different views. They can't handle when they're wrong, because then they would have to admit that they're wrong, and they would have to admit that somebody else is correct. So it's very hard to do therapy with people when you're challenging them on their false beliefs and their perceptions and their thoughts and their attitudes. They take it incredibly personally. And then you're ending up in what we would call, you would have resistance to that. And a good therapist doesn't really want to deal with resistance because it means you're working at your client or to your client. You're not working with your client. However, if you're a good therapist, how do you work with somebody's irrationality and say it's okay? It's not. So this is a very action-oriented type of therapy, and a lot of people don't like action. They like to talk and complain, but they don't want to do anything. And it's also, again, I've said it a bunch of times, it's based in reality, so there's not a lot of wiggle room here. It either is or is not. And because of that, you can put people in a position where they're going to have to grow up, and it's very hard for younger people to grow up today. They don't want to hear it. Something else that I think gets in the way of CBT is that in this world today, we're normalizing dysfunction. We're normalizing things that are not normal. For example, let's take the medical field, for example. We could say that if you have a heart problem, that's normal because human beings get older or whatever happens, and there's a lot of human beings with heart problems. So in that sense, it is very normal. However, if you are in the medical field and you're going to look at a person and say, well, you have a heart problem, so let's completely normalize this. Don't worry about your diet. Don't worry about doing physical activity. Let's just go down the road of having the heart problem and we'll make it okay. So that's how we'll make it normal. No, it's still a problem even though it's normal. So we need to do something to correct it. What's happening in therapy now is that we're taking so many thoughts and ideas and or behaviors, and we're normalizing them to say it's all okay. No, it's not okay. Sometimes we're dealing with delusions and we're saying it's all right. Here's an example of that. And I think, again, social media is a lot to blame here. More than once, but again, this week, I've had another conversation, had a young guy, about 16 years old. Now, at 16, you're pretty much a man, but in this day and age, I guess you would consider him a boy. Not that I asked him, he just came up and he wanted to tell me. He's like, well, I'm polyamorous. I'm like, well, that's interesting. Okay, tell me what that means to you. He goes, well, I talked to a couple of boys and I talked to a couple of girls and I text them and, they're boys and girls, so I'm polyamorous. Okay, so there's so much stuff on social media today getting in the way of these young people's brains that they don't even understand what they're talking about. In other words, upon further examination, at 16, he's never even kissed a girl. He's never even kissed a boy. He hasn't done anything. He's texted a couple of people. But yet in his mind, because of what he's reading on social media and seeing on TikTok, he believes he's polyamorous, which makes no sense. Now, we can't normalize this. This is not normal. It's normal in the sense that a lot of young kids now identify as polyamorous. But it's not normal because they don't even know what it means. Here's the thing. When people are young or older or middle-aged, doesn't matter. Let's say you want to go out on a date and you're trying to see what you want in life, of who you like, who you want to spend more time with, who you don't. So you date a person, then you date a different person, then you date somebody else. Listen, nobody expects you on a first date to get married and never see somebody again. You're allowed to date different people. That doesn't mean you're polyamorous. It means that you're dating. It means that you are playing the field. That would be normal. We shouldn't be normalizing people, or they're getting into these adult conversations about polyamory when they've never even kissed somebody yet. It's I don't even understand that. Again, on further examination of this, I've had people come to me and they'll say, "Well, I'm one of the 72 different genders that are out there." 72 genders? Really? Like, some of them are, I feel like a boy in the morning, and then in the afternoon I feel like a girl, and then somewhere in the middle I feel like I'm a little bit of both, so therefore my genders change. I'm gender fluid. Listen, we are confusing people so much. I've read studies where there's about 25 to 50% of adolescents are confused about their sexuality. There should be no real confusion here. Like, we are putting out so much bad information to people, and we're not challenging it, that we're allowing this. So as more and more people are getting into therapy, what's happening is that more and more people are anxious and depressed and committing suicide. It's not helping because the people who are professionals, they're not challenging their clients correctly. And I don't want to turn this into a gender thing today. I can do that on another show. So I just wanted to touch on that today, of how many young people come to me and they're talking all around circles. I had one person say to me that they were a certain type of gender because they were attracted to people's personalities. Right. We all are. Like, you're not special. And in a world where you're on social media all the time and you don't know how to connect to other human beings and you don't have face-to-face contact with human beings, they're trying to look for ways to be special and different. And when everybody thinks that they're overly special and overly different, it means that nobody is. So they're doing these crazy things and thinking that they're so original that they're making up a whole new gender just because they like people based on their personality. Well, I think we all do that. I don't care. It doesn't, like, who would have thought that people like people based on their personality? I don't understand this. These things need to be challenged. We can't say that because about 25 to 50% of teenagers have no idea what their gender is and they're confused about what they like and what they don't like. We can't just normalize it to say it's okay. It's normal because there's a lot of people that are like that, yes. But this is a severe, severe dysfunction in these people and our society in general. We need to take a look at it. So once again, quick little synopsis. CBT, REBT. It challenges people's opinions, thoughts, perceptions, feelings, and it wants to put people in reality. It's going to look at their core beliefs to see if they are irrational or not, if their thinking is distorted. When you look at people's views like this and challenge them on their distorted views, their irrational beliefs, you're going to use modern words, you're going to trigger them into a trauma response. And it's very hard for them to look at themselves to think that their way of thinking could be wrong and has anything to do with the fact of why they're dysfunctional in this world or how their behaviors affect themselves in this world. Hopefully this was eye-opening to you in some way. My name is Joe Peroni, and this is the Rise Above Project. Please subscribe and tell a friend. Thank you.